Hi, my name's Dana Smith,
And I'm Monica Grisdale.
and we're junior occupational therapy majors. We're here to talk to you about the OT collaboration with pre-health.
So we just want to start off with a definition of OT and explain to you what occupational therapy is. So occupational therapy is a holistic therapeutic service that aims to help people across the lifespan complete occupations that they want to and need to do. An occupation is defined as a meaningful everyday activity, and this includes activities of daily living, instrumental activities of daily living, sleep, work, play, leisure, education, and social participation. We also use the word holistic in our practice, which means that we view the person as more than a case or a client, but as the entire person, taking into consideration social, societal, and mental factors that may impact the overall well-being of that person.
Occupational therapists usually work in a variety of different settings. Some common areas are hospitals, schools, nursing homes, clinics, group homes, psychiatric centers, and community-based settings. So we just wanted to give some examples of some ways that we can collaborate with some physicians or other health professionals. So examples, we work together in an interdisciplinary team in hospital settings. We also will consult each other about different patients and make joint decisions on discharging different patients. Physicians often make referrals to OT, and then we also can make suggestions to see a physician or physician assistant if the client's having a problem. We just wanted to mention this because it's super important that we know each other's roles and the basis of each other's profession so we can successfully work together and make sure that our clients are getting the best care possible. So one thing that we wanted to mention was interdisciplinary teams and how important they are in the healthcare setting. So we found a research article that was done on interdisciplinary teams in a mental health setting. The results show that enhancing interdisciplinary teamwork is super important to effectively address the full range of needs and issues experienced by people living with mental illness. The article also goes on to talk about some barriers to interdisciplinary teamwork. One of the barriers is the power and status differences between the professions. So one profession that may have a higher attitude on their power in the workplace, they may end up devaluing another person's perspective and discourage building respectful relationships among the other team members. Another barrier that actually affects OT the most is having limited knowledge on the other professions. So it's really important that we learn about each other's perspectives, knowledge and expertise, and that will allow the client to get the best care possible. And then another barrier would be managers, supervisors, and insurance companies not supporting interdisciplinary actions or education among the team members. We also wanted to talk about adaptive equipment. These are devices that we use to teach clients to compensate and adapt while performing their occupations. It's any device used to help disabled individuals accomplish everyday tasks and activity to assist in improving their quality of life. We wanted to mention this because adaptive equipment is commonly seen in hospitals, which are a setting that we will both be working together in. There's also different types of adaptive equipment, some categories. The first one is mobility aids. This would be something like crutches or a wheelchair. There's also memory aids, which would be medication reminders or any type of a learning device. Sensory aids would be any type of hearing aid or braille. And then daily living aids, which we will go further into, are things like a reacher, a tub bench, or a long-handled hairbrush.
So we're going to be introducing to you 3 daily living aids. The first one is the reacher. A reacher is used to assist an individual with range of motion that is limited. It allows the individual to achieve greater levels of independence as they're now able to better reach and interact with the environment around them without any physical assistance from another individual. The reacher allows the client to reach high or low spaces that they typically could not reach without the use of the reacher.
So another piece of adaptive equipment is the sock aid. So this obviously will help an individual put on their socks. Individuals that do not have the shoulder or trunk range of motion to be able to bend down and reach their feet may benefit from using a sock aid.
The last piece of equipment that we'll introduce is the leg lifter. The leg lifter is used to assist individuals in transferring and moving their leg when mobility of the hip or strength of the hip is limited. This allows the individual to independently lift their leg to the bed. The leg lifter is also useful to assist the individual in moving from lying on the bed to sitting on the edge of the bed. Similarly, it may be used to move the leg into the bath while on a bath board. OTs are also involved in reducing the amount of acute readmissions. This article is from the American Journal of Occupational Therapy. It's titled Occupational Therapy's Role in Preventing Acute Readmissions. The article mentions that hospital readmissions have become a large concern in the medical field. In 2012, the overall readmission rate was 19.2. Our scope of practice as OTs includes prevention, education, compensation, creation, establishment, and maintaining function. Within the acute setting, two of the main areas that we focus on are prevention and education. So we educate our clients and their caregivers about the needs of the client, ways to complete occupations, and tips to promote overall well-being, as well as encourage and take steps to prevent falls, pressure ulcers, deep vein thrombosis, pulmonary embolism, venous thromboembolisms, and diabetes. Two quotes that I found relevant from this article include individuals with unmet ADL needs were more likely to be readmitted within a year, and 1 in 4 Medicare patients return home with unmet ADL needs. Occupational therapy's role is to address these ADL needs, and we largely focus on creating independence and successful ADLs as occupations. The second quote was, "Self-management is a key element in successful post-acute care, and occupational therapists are experts in motivation, task analysis, and psychosocial context, which all contribute to enabling positive outcomes." To end, we have 2 case studies that you guys can think about. They both involve adaptive equipment and different clients that we would both see in a hospital setting. So the first is a client has an L2 spinal cord injury and is wheelchair bound. The client wants to be able to locate items around their house easier from his wheelchair. He has trouble reaching items from the cabinet and from the floor, but does not have the expenses to fully adapt his home. So in this case, an OT might work with the client, very client-centered approach, and recommend a reacher if that's what he would like to use. The reacher would be the most useful device for the patient, allowing him to grab and reach different items from his wheelchair.
So the second case study that we have is an 86-year-old female that recently underwent hip replacement surgery. She's unable to bend over to dress herself or pick things up from the floor. So from the 3 adaptive equipment pieces that we talked about, we said that all 3 of them would benefit this client. We said the sock aid would allow the client to put on socks without having to bend over to reach their toes. We said the leg lifter would allow the client to lift their legs onto the bed without having to reach to grab for her legs. And then the reacher would allow the client to pick things up from the floor without having to bend over. So this is the end of our presentation. We wanted to thank you guys for listening in and viewing this. We hope to, in the future, have more collaborative events with you guys. I think it's very beneficial. We hope you enjoyed our presentation. Thanks.